everyone, welcome to my channel. In this video, I will talk about malabsorption syndromes. Um, Malabsorption syndromes are four different types, maybe lactose intolerance, chronic pancreatitis, celiac disease, or small intestinal bacterial overgrowth. I'm going to touch up very briefly about these topics and we'll do some essential important questions related to it. In the other video, I have spoken about celiac disease in detail because it's a high yield topic for the exams. So lactose intolerance patients presents with diarrhea after lactose-containing meals, and it causes elevated stool osmotic gap, usually more than 50 milliosmoles per kg, and a low stool pH because of uh, hydrogen in excretion into the stools, and the positive lactose hydrogen breath test as well. Chronic pancreatitis, greasy stools, abdominal pain which radiates to the back, and celiac disease, high stool osmotic gap, microcytic anemia, and deficiency anemia with Willis atrophy on biopsy. Small intestinal bacterial overgrowth presents with macrocytic anemia with B12 deficiency, and lactulose breath test is positive in such cases. This is a very high yield presentation. Patients with B12 deficiency and lactulose breath test positive. Very important to keep the differential of small intestinal bacterial overgrowth. Okay, so let's start and differentiate different types of fat malabsorption syndromes. As I said earlier, celiac disease is one of them, Whipple's disease, in addition to that, pancreatitis and tropical sprue. So how do these syndromes present? They present with fat malabsorption, and the complaint is usually pale, bulky, foul-smelling stools, which is uneasy to flush. Some of the unique features associated with celiac disease is that it always shows a positive autoantibodies against gluten, right? Dermatitis herpetiformis is one of the skin conditions associated with celiac disease. Uh, and the diagnostic testing in relation to celiac disease, usually the small bowel biopsy from the distal duodenum. This is important. In celiac disease, the distal duodenum is commonly affected, and the biopsy shows Willis atrophy, crypt hyperplasia, and lymphocytosis, along with positive autoantibodies and an abnormal D-xylose test. Okay, we will talk about the D-xylose test in detail, but remember that celiac disease has an abnormal D-xylose test. The treatment here would be restriction or avoiding gluten. Okay, so Whipple's disease again presents with fat malabsorption. It is caused by Treponema whippleyi, which is a gram-positive rod, and it causes a triad of cardiac symptoms, arthralgias, and neurologic symptoms. This is very important. The way you can remember the triad is CAN, Whipple's CAN. The C here stands for cardiac, A for arthralgia, and for neuralgia. The small bowel biopsy shows a positive organisms with foamy macrophage and intestinal lamina propria, and that's the buzzword, the PAS positive. Okay, then PCR reaction of stools showing T. whippleyi is done, and then also abnormal D-xylose test, right? Then pancreatic insufficiency is very common among patients who are, alcoholics, and a history of previous episodes of pancreatitis. Okay, you always do an abdominal CT scan and secretin simulation test, and the treatment here would be enzyme replacement therapy. Now, tropical sprue also causes fat malabsorption, right? And essentially, it's very important to look into history in case of tropical sprue, and they are very commonly presented in tropical areas. Okay, so patient might have been visiting a tropical area. Okay, so you need to look into travel history. These patients have a negative autoantibodies, and it's very important to rule out celiac disease because it's very, very similar to tropical sprue. Okay, so you rule out celiac disease by ordering specific tests related to celiac disease. Okay, that is negative in case of tropical sprue. And tropical sprue presents with megaloblastic anemia due to folate and vitamin B12 deficiency. This is again a very high yield point. All right. Then diagnostic testing would be a small bowel biopsy, which shows villus blunting atrophy lymphocytes, plasma cells, and eosinophils. You see, it's very common, very similar to celiac disease. Now, what makes it different is that tropical sprue affects the entire small bowel, versus the celiac disease affects only the duodenum, the proximal part of the duodenum. Okay, so that's the difference between the two. And the second difference is that celiac disease is treated with avoidance of gluten, versus tropical sprue is treated with the help of antibiotics like tetracycline. All right. Now, what is D-xylose test? A D-xylose absorption test is used to diagnose small intestine malabsorption versus pancreatic disorders. Okay, so abnormal D-xylose testing indicates that villus lining is destroyed or impaired, therefore resulting in a malabsorption of D-xylose. And if you notice that it is positive only, abnormal only in case of the diseases which disrupts the intestines, and is not done in case, it's normal in case of the pancreatic insufficiency. All right, so those were the different types of fat malabsorption syndrome. Now let's solve a question. So a 47-year-old woman presents to her primary care physician for abdominal pain. She states that the past month she has experienced abdominal pain, diarrhea, bloating, weight loss, and excessive flatulence. And I want you to remember highlight these points, the presenting symptoms. Now, her current condition medications include metformin and insulin. The patient states that recently she has experienced significant anxiety, multiple panic attacks, and worsening GERD. Her diet consists of fruits and vegetables, some dairy products for proteins, and temperature of 37, blood pressure 140/80, pulse is 90, respiration 13, oxygen saturation 96. Physical exam shows borborygmy upon abdominal examination and diffuse abdominal tenderness. Inspection of the patient's extremities reveals spasticity. I haven't put the picture, but it shows scleroderma-like picture. Okay, and cardiac exam and pulmonary exam is within normal limits. Neurologic exam is notable for decreased sensation bilaterally in the lower extremities, as well as ulcer on the ventral aspect of the lateral foot. So some blood tests have been done. So which of the following is the most likely cause of this patient's presentation? Now, if you notice that this patient's, bilateral lower extremity ulcers, ventral aspect of the lateral foot, um, these goes more with the scleroderma-like picture. Okay, so and presence of abdominal pain, diarrhea, bloating, weight loss, and excessive flatulence. Okay, so the answer here is yes. Okay, it's normal flora overgrowth. Okay, so decreased GI motility can occur in pathologies such as diabetes mellitus because of decreased neural input to the bowel, or scleroderma, fibrosis of the bowel wall. All right, so when the bowel is unable to undergo peristalsis, overgrowth of the normal flora can occur, and this bacterial overgrowth can lead to symptoms such as abdominal pain, bloating, diarrhea, flatulence. Treatment in this case would be include antibiotics like rifleximide or amoxicillin clavulanate, or in prokinetics such as erythromycin and metoclopramide. So other gold standard test for this is jejunal aspirate, which will show colonies more than 10 colonies forming units per ml. Or you may do a carbohydrate breath test, or treatment with rifaximin. Rifaximin basically inhibits bacterial RNA synthesis. Okay? So that was small bowel bacterial overgrowth. Next up is this question. Okay, So, a 42-year-old woman comes to the office due to episodic diarrhea over the past several months. The patient describes large bowel watery diarrhea accompanied by flatulence, typically a few hours after a meal. So, the diarrhea is followed by a meal. And she's no fever, abdominal pain, blood and stools, nocturnal diarrhea, nothing as such, but she has a history of Hashimoto and she takes levothyroxine. Now, um, bowel exam is normal. Okay, the physical exam is normal, and stool testing for ocal blood is negative. Blood cell counts, pH, TSH, everything is normal. Which of the following is the most appropriate response to the patient's regarding with her? And it certainly shows your symptoms are likely due to lack of digestive enzymes and should improve with change in your diet. Because you see that this episodic diarrhea, okay, is large volume, watery diarrhea, accompanied by flatulence, typically a few hours after meal. When we were talking about the acute diarrhea in the older videos, uh, I said that the large volume diarrhea are mostly associated with osmotic diarrhea. Yeah, and um, and and the fact that the diarrhea is followed by a meal, and certainly associated with some sort of food which is triggering the diarrhea. Okay, so this patient actually has the lactose intolerance. Chronic watery diarrhea, flatulence, bloating after meal likely has lactose intolerance. So lactose intolerance is a common cause of adult onset diarrhea due to malabsorption and typically presents in adults aged 20 to 40 years. Okay, so um, so this is all about lactose intolerance. So primary acquired persistent lactase deficiency or onset usually in early adulthood versus secondary small intestinal epithelial damage due to infection like gastroenteritis or inflammation, often transient weeks to months. So secondary form of lactose intolerance is common compared to mild primary. So basically, the lining of the intestine has these lactase enzyme, which gets disrupted due to recent gastroenteritis infection. Okay, and that results in loss of the lactase enzyme and lactose intolerance as a result. Okay, patients present with GI distress after diarrhea intake, where the patient complains of periumbilical abdominal pain, flatulence, bloating, watery diarrhea. The diagnosis is resolution of symptoms on dietary-restricted diet and a positive lactose breath test. The management here would be a dietary restriction of lactose and lactase enzyme replacement. So, and additionally, an important point is that all patients should also be counseled on maintaining an adequate vitamin D and calcium level. Okay, because lactose comes from the dairy product and underconsumption can lead to deficiencies. So this is all about malabsorption syndromes. And in another video, I will talk in detail about the celiac disease, which is actually a quite high yield topic. And then see you there. Thank you very much.